Let me go first. Hi, guys. It's good to see you. This is my second time at Day with the Experts. I'm a Southerner, and so I am new to Raisman. I guess I'm not even new anymore because I've been here almost 2 years, but anyways, it's great to be here. My name is Lily Wagner, if I didn't say that. Sorry, it's the morning. I am a clinical psychologist and a researcher here at Waysman. I have a lab focused on implementation science and really thinking through early identification of autism and other developmental disabilities. And I also direct the Autism and Developmental Disabilities Clinic here at the Waysman Center. But I'm really just a sidekick to this beautiful presenter. Yeah.
Good morning, everyone. My name is Kathleen Kastner. I'm a developmental pediatrician here in the clinics at the Waysman Center. And we are so excited to be here this morning. We're going to talk a bit through a framework for thinking through intervention decisions. When families are exploring interventions for their autistic child, it can be a really overwhelming process. There's so many different options to consider, and there's often recommendations coming in from a lot of different places. And increasingly, there's just an incredible amount of information that families have to sift through, some of which is really good and some of it is not. So families are left trying to figure out how do I move through this process? What's best for my child? So today we want to take a little bit of time to talk through a framework for navigating these decisions. And as we get started, we really want to make sure that we're centering any decisions about intervention in the principles of neurodiversity or neuroaffirming care. For some folks, this might be a newer concept, so I just want to take a quick minute to talk about what this means. So neurodiversity is a term that's used to describe that there's many different ways that people's brains work and that everybody has strengths and challenges. Neurodiversity acceptance is really rooted in this idea that people with disabilities, including autism, that doesn't diminish their personhood, and it shouldn't be viewed as a disease or a problem to be solved. Instead, these variations are just an important part of what make people people. So then by extension, neuroaffirming care or neurodiversity affirming care is medical or mental health care that acknowledges and affirms this acceptance. The goal is not for the care to eliminate someone's neurodiversity or make them neurotypical. The goal is to make sure everybody has, what they need to live a fulfilling life. And so we want to make sure that as we are thinking about any intervention, whether that's a therapy or a medication, that we are focused on this perspective of making sure that people have what they need to live full lives. Throughout history, autistic people have been subjected to unproven treatments, often with little to no benefit and sometimes which caused harm. So we want to make sure that any intervention is carefully evaluated for its potential benefits and risks. And the focus should be on accessing interventions that improve somebody's quality of life. I think this graphic here on this next screen illustrates this principle really nicely. This is from an autistic advocate at NeuroWild. If we don't focus on these pillars at the bottom of identifying someone's strengths, developing a positive identity and acceptance, building up their support network, and addressing their safety and health needs, then we're not going to be successful in helping them build skills up at the top of this tower. So we want to make sure every decision we're making is rooted in this strengths-based perspective. Okay, so at the end of the day, there are so many different ways to support development. And as parents are weighing decisions about pursuing interventions, there's a lot of variables to consider. It can be really helpful to walk through a series of questions to help identify how an intervention might or might not be a good fit for your child. So some of the questions that can be helpful to think through, what is the goal? What is this supposed to help with? Is that an important goal for my child, for my family? And does this fit with that idea of neurodiversity acceptance? How does this fit with our priorities as a family overall? As well as, is it something we can access? Is it available in my community? How much time, money, energy would be needed to access this? Is it realistic for our schedule and our resources? Does it detract from other things that are really a priority for our family? All of these questions are obviously going to be individualized and different for each family, and likely you would experience different answers at different points along your family's journey. But then when we move over to the other side of this list of questions, there's a couple questions that we need to turn to other sources of information to be able to answer. Is it safe, and does it work? And this is where research comes in. So you often hear folks talking about evidence-based interventions, right? And this is where research helps us to answer these two questions. We still want to integrate it with the other questions on the list. We always still want to think about how all of this fits together for each individual family and child. But these two questions in particular, we need to turn to research to be able to answer those. So we're going to talk a bit about how we think about evidence-based interventions.
Who's ready to talk about research? Here we go. Okay, so as Katie said, there are a ton of options out there. I feel like every day you're hearing about different therapies and medications and interventions, and it can feel really overwhelming, obviously. And research is just one tool that helps us answer those questions that Katie was asking, right? Like, is this going to help? Is this safe? But research doesn't give us one right answer. It's just a tool that helps us, guide our decisions. We ultimately have to decide, is this going to be right for my child, for my family situation, for my goals? So again, I think it's really helpful to think of research not as like the be all end all, but just a decision support tool for us, right? I'm sure you have heard the phrase evidence-based a lot, and you'll continue to hear it. Something we say all the time, but not all evidence is created the same. Higher quality research is really going to help us feel more confident that the effects that we're seeing are real. Some key things that we look for when we're determining whether something is evidence-based are studies that include enough participants, findings that are repeated across multiple studies, research that tries to rule out other explanations. Like one of my favorite examples is, like if we give our kiddo a vitamin and then they grow taller, so did the vitamin make them grow taller, or was that just normal growth and development? So research tries to separate out what would have happened anyway versus what the intervention actually caused. Peer-reviewed research just means that other experts who are not involved in the specific research study carefully reviewed the research before it was published. It's kind of like a quality check. You can think of it as like getting a second opinion from a doctor or having multiple people read your college admissions essay before you send it in. One really important, sorry, I feel like I'm like moving. One really important thing that I want to talk about is the distinction between correlation and causation, because I think those things get conflated a lot. So correlation means that two things are happening at the same time, where of course causation means that one of those things is causing the other to happen. And just with summer upon us, or me just willfully thinking that summer is upon us, I wanted to pull this example. So we know that in the summer, ice cream sales go up, and so do sunburns. I get them a lot. Does this mean that eating ice cream causes sunburns? No, it does not. So there's a third factor, right? The sun. And so the sun is why, right? Like people are getting more sunburns and people are eating ice cream. But just because those two things happen at the same time does not mean that one causes the other. So this is why we have to be really careful when we hear that something worked. We have to really ask and look for, was it the intervention or something else happening at the same time? So once we understand that two things happening together don't necessarily mean that one caused the other, the next question we have to ask is, how do we make sure that research is actually giving us accurate answers? And that's where the idea of bias comes in, which is probably something a lot of you have heard about before. Bias just means that something is skewing the results, often without anyone intending for it to happen. And these are a few of the most common types of bias that we try to control for in research. So one is selection bias, and this just means that maybe the kids or participants in the study are not representative of all kids and families, right? Response bias. So if people know that they're getting protection, they may report that they see an improvement differently. I am incredibly guilty of this. I like placebo effect. If you tell me that I'm taking medicine, I'm like, oh, I feel amazing. So, and then on the other hand, observer bias, right? So this is if the person who is administering the medication or intervention, whatever it is, if they know who's getting it and who's not, they may kind of willfully see an improvement that's maybe not really there. And then attrition bias. So an example of this might be like if families who are in the study are not seeing improvement and drop out, it might skew the results, right? Because the results that we're getting are only from the people who are actually seeing improvement. So these are just things that we try to control for. Good research tries to minimize these as best as we can, but it's never perfect. And this is why testimonials or really small studies can sound really convincing sometimes, but they might not be telling the full story. These slides are so good. Katie found a lot of these pictures and they're so pretty. I'm going to use all them. But a randomized control trial, or RCT, is often considered the gold standard of research. It's what a lot of us look for when we're, kind of first looking to see if there's good quality evidence for something. And this is because participants are randomly assigned to different groups at the beginning, and this helps make sure that the groups are similar to start. Because if you think about it, like if you take this whole room of people, right, we all have different factors that are going to affect our outcomes, right? We have different levels of family support, different ages, we have different motivation. And if we, the dice and randomly put us into two different groups, that just helps make sure that all of those factors are kind of distributed. So not one group has more of an advantage than the other at the start. And this way, just if we see differences later, we can be more confident that it's the intervention that really caused it. Sometimes studies are blinded, which means people don't know which group they're in, which helps control for that response bias that I talked about earlier. Or really high quality studies might be double blinded, right, where the person administering the intervention isn't aware of which group the participants are in either. It's basically the research version of a FAIR test. But again, even RCTs don't answer everything, right? Like as Katie alluded to, historically, there have been lots of groups and people who are underrepresented or excluded from research, right? So people of different races and ethnicities, people who don't speak English, people with disabilities, right? And so that's why it's still, even though it's an RCT, you still have to ask yourself, like, does this apply to me and my family and my child? Okay. So when you're trying to make decisions for your family, you're probably getting information from all kinds of places, right? Like a lot of us go online. Maybe we're looking at the CDC website. Maybe we're looking at TikTok. I don't have that because I'm old, but I hear that people get a lot of good information from there. And especially one of the best ways to get information is hearing from families who are going through the same experiences that you are. And that can all be really helpful. But they're not the same as how much we can rely on that information. So some types of information are based on one person's experience, and some are based on those carefully controlled studies with multiple participants. So we can think of it really as a range, and all of it has a place, right? So at one end, we might have these personal stories or testimonials. Then we have studies kind of where we observe what's happening, maybe with a small group of people. Then more rigorous studies that are more carefully designed, where we're randomizing. And then, of course, at the top, the strongest end, the reviews that just combine the results from a lot of really carefully well-controlled studies. And it's really important that we take all of it into account, but we have to be aware. We have to be aware of kind of the quality of the research that we're looking at. And I'm going to turn it over to Katie to talk a little bit more about that.
So when we're, thinking about applying this specifically to medications, because medications carry risks, we really kind of set that gold standard at the higher end of this hierarchy or this listing in terms of the quality of evidence, right? The expectation is that we're doing these well-designed experimental trials to try to minimize bias as much as possible, so that we can assure we have a good understanding of does it work and is it safe before we would proceed with a medication. And to just talk for a quick minute about, how medications work in our country, because there are processes in place that regulate, whether medications can come to market, and they're often using these research studies at the higher end of that list to determine if a medication can be approved. That process is regulated by the FDA. The FDA also oversees somewhat the regulation of supplements, so vitamins or other supplements that are not prescription medications, but the processes are very different. And so I think it's helpful to just have a little bit of an awareness of how that can look different, so this can, factor into your decision making when you're deciding about interventions. So when we're talking about a pharmaceutical medication, something that would be prescribed, the FDA requires manufacturers to go through a really rigorous process before they can start to sell the medication to prove that it works and that it's safe. And if there are risks, what are those risks so we can understand them really carefully? This is called pre-market approval. That has to happen for any new medication before it can be sold. The FDA also requires the manufacturers to test the thing they're creating, the actual compound, on an ongoing basis to make sure that it is high quality and consistent. So every time they create a bottle, that it's the same and it has what we think it has in it. And then because of that requirement to go out into the market, manufacturers are allowed to make treatment claims in their advertising. They're allowed to say, this medication helps with this thing, because they've shown that to be true through the research. The process for supplements is different. So supplement manufacturers do not have to get any approval from the FDA before they start to sell their product. They don't have to prove that their product works or that it's safe specifically. They don't have to get any approval from the FDA first. The one kind of slight exception to this is if it is a totally new ingredient. Since the mid-90s, anytime a new ingredient comes out, the company does need to submit a notice to the FDA, and they have to show evidence that it's reasonably expected to be safe, but it's not the same level of evidence that a pharmaceutical medication would have to go through. And importantly, that's only with a totally new ingredient. So not a new company, a new manufacturer, a new version, just a totally new ingredient that's never been sold before. There's not a requirement for quality testing for supplement companies. They don't have to do this ongoing quality testing to be able to sell it. And because of that, they're not supposed to make treatment claims. They're allowed to make what are called structure and function claims. And you might have seen some of this phrasing if you've ever bought like a vitamin or a supplement. On the left-hand side, they're supposed to put this statement somewhere on the label or in the commercial. Anytime they're making structure and function claims, to acknowledge that this has not been approved by the FDA. They haven't proven that this can treat, cure, or address any particular condition. But they are allowed to make these kind of general statements, like it enhances your health, it supports your development, supports a balanced mood. This is kind of like on the level of saying, like, if you eat food, you'll feel better, right? It doesn't need to specifically prove anything. It's just kind of like a general acknowledgement that, taking something that's a food or a nutrient can be good for your body. So this is a different level of evidence for those supplements. And so that's why it's often can be trickier to navigate, because there hasn't been as much research done in terms of whether they work and are they safe when families are trying to make decisions about supplements. Okay, so how do we put all this together? So going back to those questions at the beginning, it really, again, is going to be very individualized from family to family. How do I take, what my answers are to these personal questions on the one side and integrate that with what the research shows? And I think one thing that can be helpful to keep in mind is how we balance out the risks with the benefits of an intervention. If an intervention is known to be higher risk and not effective, like something in the black circle here, well, then that's really something we should be avoiding, right? If something is known to work and it's low risk, like over towards the light blue circle, then that's probably something you might want to consider, right? But in between is where it gets a little trickier to tease apart. As a general rule, though, when there are higher potential risks of an intervention, then the evidence really needs to be stronger to prove that it works. And we need to understand more about those risks so that we can know if there are steps we can take to minimize it. Medications, like I said, require a higher threshold to prove that it works because of those potential risks. If we're talking about an intervention that's really low risk, like changing your bedtime routine, then we probably don't need a lot of evidence to know for sure it works before we try it, because the risks are really low and we could give it a try and see if it works. But as those risks increase, then our bar for proving that it works should increase as well, and having a better understanding of what are the risks so that we can know how to minimize them and be able to weigh out the pros and cons of any risk that there is. Okay, so how do we kind of wrap this up? We know a lot of families are busy and trying to weigh through so much and probably don't have time to dive through the journal articles on a regular basis. So this is where it can be helpful to have a little bit of a sense of what are some key things to look for and who can I turn to for more information. So the different specialty societies for the areas of medicine that you're looking into a treatment for can be a great place to turn. They often invest a lot of effort and energy in reviewing the evidence to come up with guidelines or recommendations, and they go through a really rigorous process of figuring out how high quality is the research to inform those recommendations. So that can be a great place to start. And any provider who's making a recommendation, you want to ask them to talk through the evidence with you so that you can have an understanding how this might fit better for your family. We encourage you to think through asking these kind of thoughtful questions when you're talking with the provider. Is this recommendation based on science, or is this mostly based on individual stories? Do they acknowledge uncertainty, right? We should be cautious anytime people are promising results or guaranteeing it works for everyone. That's just not how the human body works. And then acknowledging the pros and cons. Every intervention has pros and cons. And so we want to acknowledge those and then be able to think through thoughtfully how that fits in with your priorities. So the goal really is to help you feel more confident and supported in figuring out if something is the right fit for your family and your child. So as a wrap up, we really want to have that neuroaffirming approach to any intervention, kind of coming back to that as our guiding principle. There's so many different ways to support development, and it is important to think through what's the right fit for your family. Research can help you answer those questions about is it safe and does it work, and then bring that together with your priorities to figure out if it's the right fit for you. Thank you all. Well, I think we might be a few minutes over, but we could take a couple questions. Okay.